Go ahead, Winnie.
Hello. Good evening, all. So, in this panel discussion, we are just discussing the current practices and challenges in a nursing perspective in the area of pediatric cardiac nursing. So, at first, I wish to introduce my department to all. So, in PGMR Chandigarh, this is one of the institution with the national importance uh, in Chandigarh. So our exclusive pediatric cardiac surgery started in 2008, and we have shifted to the advanced cardiac center, exclusive cardiac center to 2009. Then from there onwards, we have continued with both pediatric and adult cardiac surgery in a same ICU. So after that, we have started a dedicated 10-bedded pediatric cardiac surgery ICU in 2019. So currently we are having 10 beds in the pediatric cardiac surgery ICU and 5 beds allotted in adult cardiac surgery ICU because our adult cardiac surgery ICU is very close to our OR. So more sick cases is easily transferred to the adult CTVS ICU. We are making provision for the for receiving such patients. 5 beds are allotted for that. So regarding the manpower, we have 4 dedicated cardiologists and 27 dedicated trained pediatric cardiac nurses. So in that, one senior anesthesiologist will be available around the clock as intensivist throughout the day, every day. So regarding the cases, so I have excluded 2020 because due to the COVID, so there are so many issues like staff mobilization for the exclusive COVID hospital. So there are very less number of cases we have conducted in 2020. So I am presenting the 2018, sorry, 2019 cases. In that we have done 607 cases with approximately 5.6% mortality. For the severity, we can see that the mainly around 80% of cases are RACHES 2, 3, and 4. So all types of cases we have done. So please, next slide, please. So regarding the pediatric cardiac nursing at PGMR. So earlier told that we have started as the adult plus pediatric combined ICU, and basically the requirements are basic education background from BSc or GNM nurses with the no special skill test requirement. The, after coming to the institution, there we are giving 10 hours induction training and rotational nursing across all specialties. This is happening in the air, but in there is a significant change in our pathway in the pediatric cardiac surgery in our PGMR happened in 2013, where children handling and children handling entered into our system, and they have tried to train us, and 100% they have succeeded. So after 13, we can say that in the path of PGMR pediatric cardiac surgery, we can say that's not only pediatric, it's the adult cardiac surgery also before 2013 and after 2013. So after 2013, there are significant improvement in the knowledge level of the nursing officers and also the outcome. So the training definitely improve the outcome of the cases. So there are we are BCH team mentored our nurses through various classroom teaching, modeling, ICU rounds, case discussions, amanda meetings, simulation trainings with multidisciplinary teams, offsite trainings at Boston Children's Hospital, and regular mentoring. So periodically refreshes our, especially Anna Madam also there. She along with the other teams periodically visit to PGA and train the whole team, not only the nurses or the surgeons, intensivists, or perfusionists. So these things changed a lot in our results. So at present, we are having specific places for holding pediatric and neonatal ICUs within the adult ICU. So that I already explained the 5 number of beds. Then 20 beds we have in 2019. We have 70 specialized pediatric cardiac nursing, pediatric cardiac surgery ICU. So this is the pediatric cardiac nursing in PGMR. So let's coming to the main focus, the challenges. What are the challenges we are facing as an Indian nurses. Yeah. So the prime thing is staff shortage as a result of
Okay, I think we lost him. Yes. So we will move on to our next presentation, and I will make note of.
just
oh, here's back.
joined.
Finish
Sorry,
your
actually,
slide, Uni. I
there is
think
some.
you're
Okay.
yeah, you cut out. Okay, go ahead.
Okay. There was some issue with my connection. So that is a main issue that we are facing the entire program in India. So that increase the workload of the nurses. Ultimately, that is badly affecting the nursing care delivery. So next thing is lack of specialist pediatric cardiac nurses. So there is no previous during the education system also not providing sufficient the specialized training. So basically medical and surgical treatment, and there is no specialized training during the education system. So we are getting nurses with there is no much exposure to pediatric cardiac or mainly just like cardiac or specialized nurses areas. So the next thing is lack of specialized nursing education. So so in this case we are very fortunate, very luckiest people because we are getting the support of children handling, but that is not the situation in others and the other centers. So some of the main centers are giving their own in-service education for their nurses through quality approach, and we are a team with the help of children handling is trying to educate the nurses in India since last 7 or 8 years through various programs, through conferences, online education programs, through webinars. So like that, we are trying to educate our nurses in India for pediatric cardiac program. But still, the that is we can see the number of nurses who are participating that. So our wish is to extend this to all the nurses. So those who are wishing to those who are wish to practice the pediatric cardiac also, and those who are working in the field of pediatric cardiac nursing also should involve in the training sessions to get it educated, because and well educated well aware nurses in the pediatric cardiac intensive care unit is very helpful for the management of the patient, and that will definitely affect the outcome of the patients too. So next thing is issues in multidisciplinary team approach. As our previous presenter also mentioned the same things. So I think these I think all these points. So this is the these are the global issues of nurses is working not only in the pediatric and all the area, specialized area. So we are doing a lot of things to tackle all these things and to better maintain a good harmony between the healthcare team. So somewhat we are successful in that. We are going with as a good team with the team approach. Then the last thing is the irregularities wages. So basically in private and government setup, there are huge gap is between the wages in government and private setup is there. So there are so many regulations are coming through the help of our apex legal bodies and nation control bodies, and even the government itself, the health ministry itself, making some lot of efforts to narrow this gap between the wages. So we hope that because all these initiatives just started 3 or 4 5 years before, so somewhat it is we have there is a good sign to sign. We can see that everything is getting into to a successful pathway. So we hope that in future also that gap will narrow, so that will increase the morale of the nurses. So the more dedicated, more educated, well-trained nurses can serve the nursing patients in our departments. So especially in pediatric cardiac nurses, we are also trying to educate our nurses. So join with us for the training programs. So that's my request.
Thank you.
Thank you.
Thank you so much, Ronnie.